in your practical exam, I've told you several times, you will be given 6 questions. Okay, 6 questions. There will be separate cards, each card having a question. You have to answer 6 such cards. One of that card will have a question called prescription criticism. That is, you will be given a prescription and you will be asked to identify what are the mistakes in that prescription. Today's class is not entirely about prescription criticism. It will be dealt in a later class. Today, to do prescription criticism, the first part is you have to know parts of a prescription. Because when you will be asked to criticize a prescription, that is, find the mistakes in the given prescription, the first and very easy mistakes to find is the wrong or problems in the structure of the prescription. That is, whether the different parts of the prescription are there or not, and whether the different parts have correct information or some information is missing. Okay, so if you know the structure of a proper prescription, whenever you will be asked to criticize a prescription, the first part you can do very easily, that is find out what are the structural problems, right? So the proper structure of a prescription you have to know, so that you can easily find out what are the problems in the structure of the prescription. Okay, so first of all, what is a prescription? These are the points on which you define a prescription. First of all, it's a written order. All of you have seen prescription, all of you have visited doctors, many of your parents might be doctors, so all of you have seen many prescriptions. So basically it's a written order. You can write it manually, you can write it digitally, but it's a written order. It's an order that is given by the physician to the pharmacist. In the prescription, it is not only an order given by the physician to the pharmacist, also an order given by the physician to the patient. In the prescription, what is written? Suppose a patient is suffering from fever and it is written tablet paracetamol 650 mg, 1 tab to be taken if temperature rises above 100 degree Fahrenheit. So here the doctor is giving a written order to the patient that if your temperature goes above 100 degree Fahrenheit, you have to take a paracetamol tablet 650 milligram. Similarly, prescription also contains some order that is directed to the pharmacist, that is who will dispense the medicine. Like suppose I will show you a prescription here. Suppose a patient is suffering from urinary tract infection and you have given norfloxacin tablet. Okay, an antibiotic. You have given an antibiotic. Total 7 days that antibiotic is to be taken and 14 tablets. So once daily you have to take 2 tablets. 7 days, 7 into 14 tablets. So the patient, so that the patient completes the course, 14 tablets is to be given to the patient. So in that prescription, the doctor will write dispense, or sometimes the word dispense. This is meant give to the patient. The word dispense is not written. Simply the doctor will write 14 tablets total, which indicates that the pharmacist will have to give total 14 tablets to the patient. So there is a direction to the patient in the prescription. There is also a direction to the pharmacist in the prescription. Okay. Then the prescription contains name and dosage schedule of the drug. As just now I told you that a patient is suffering with urinary tract infection, you have to complete a dose of antibiotic for 7 days. 7 days, twice daily, 14 tablets to be taken. Okay. So there you have to write in the prescription norfloxacin 400 milligram tablet. So you are writing the name of the drug. You are writing the regimen, that is 1 tablet twice daily for 14 days, the entire regimen of treatment. And you are also writing the dosage schedule twice daily. Even you will be writing the dosage form, tablet. So all these informations are present in the prescription. Prescription also has instructions for preparation and dispensing to the pharmacist. As I told you, 14 tablets you have to give to the patient. The doctor will simply write 14 tablets when he is writing down the order, so that the pharmacist knows that he has to give total 14 tablets to the patient to complete the course. Instruction for the patient regarding intake, like the tablet is to be taken twice daily. This is instruction for the patient. These type of instructions are present. And very important, in a prescription, ideally you should write the generic name. In an earlier class, we have discussed the nomenclature of drugs. And nomenclature of drugs includes brand name and generic name, right? Generic name is basically, to easily remember, it's a pharmacological name, like paracetamol tablet, norfloxacin tablet, okay? Or suppose তোদের কি হয়েছে GI system হয়েছে তাহলে pantoprazole tablet, ঠিক আছে, domperidone tablet, like that. So these are the pharmacological names of the drug, pharmacological names, ঠিক আছে. Prescription always write the pharmacological names, the generic name. Don't write brand names. Brand names হচ্ছে the same drug, the same pharmacological agent, that is paracetamol, domperidone, pantoprazole. They are sold by various different pharmaceutical companies in the market, and these companies give a separate name to their product. Okay, like paracetamol has a name called Crocin. It is of particular company, GSK. Then there is another name Calpol. Then there is another name Pyrigesic. Then someone called it simply P with the strength 500, 650, like that. So these are various brand names. Ideally in a prescription you should not write brand name, and there is a lot of controversy regarding it. Few months or 1 year back, the NMC made it mandatory that in prescription you should always write generic name only, no brand name is allowed. But it raised a lot of hue and cry among the medical community that if you are restricting doctors from using particular brand, because quality of brands do vary, it's a reality. So if you are restricting doctors from writing brands, then it will affect patient care, and you are interfering in the doctor's right to treat the patient. You are also denying the patient getting a proper guidance from doctor regarding the brand to choose. So after that, again the government took few steps back, and that mandatory clause was not kept, and it was diluted to like preferably something like that. Okay, but ideally the NMC wants, and the government of India wants, that in prescription doctors should write generic names, and that too in capital letters, because when you write in capital letters it becomes legible, পড়া যায়, নইলে হাতের লেখা খুব সাংঘাতিক হয়। তো প্রেসক্রিপশন লিখতে লিখতে সারাদিনে এরকম অভ্যেস হয়ে যায় যে যার খুব ভালো হাতের লেখাও ছিল, হাতের লেখা ইন জেনারেল খুব খারাপ হয়ে যায়, এটা খুব কমন, একদম পড়া যায় না। তো শুধু যে ওষুধের দোকানে বিক্রি হয় ওই লোকটাই বুঝতে পারে, আর কেউ বুঝতে পারে না। অদ্ভুত স্যাম্পল আছে, সবারই হয়, কিন্তু কিছু যেন অদ্ভুত হয়ে যায়, শুধু দাগ কয়েকটা, এর বেশি কিচ্ছু নেই। তো বিকজ প্রেসক্রিপশন ইজ আ লিগাল ডকুমেন্ট, this is absolutely not allowed. At the medical legal case, or if there is a medical legal case, that prescription is the proof on which the doctor will defend, and that prescription is the proof on which the patient will ask for compensation. তো ওইটা ওরকম দাগ হলে হবে না, and it will go against the doctor. You are not allowed to write such an illegible prescription. It should be legible. So it should be written clearly, handwriting should be legible, and it should be written in capital letters. And NMC now wants preferably that digital prescription or prescription by electronic methods, okay, should be used. That you will type the prescription and give a printout to the patient. But in India, the infrastructure does not allow it in most of the cases. Medical college গুলোতে সম্ভব হয় না, so isolated chamber এ কি করে সম্ভব হবে? But that is what NMC wants. What are the parts of prescription? পরীক্ষায় এই পার্ট গুলো সব আছে কিনা এবং এইগুলোতে কিছু গোলমাল আছে কিনা, that is what you have to identify, whether all these parts are present or whether it's a problem. If these parts are present, whether the content is correct. দেখ, প্রথম পার্টটাকে বলে সুপারস্ক্রিপশন। প্রেসক্রিপশন তোরা দেখেছিস, all of you have seen prescription. প্রেসক্রিপশনে কখনো in the upper right or in the upper left you first have the doctor's details, তাই তো? দেখেছিস তো প্রেসক্রিপশন, ডক্টর ডিটেলস প্রেসক্রিপশন উপরে থাকে, আপার রাইট বা আপার লেফট। আইডিয়াল রুল হচ্ছে আপার লেফট। ইন দ্য এক্সাম ইউ উইল সি whether it's in upper left or not. তো আপার লেফট সাইড, আই এম সরি, আইডিয়ালি ইজ দ্য প্রেসক্রিপশন আপার রাইট, ঠিক আছে, আপার রাইট ইজ দ্য আইডিয়াল। So you have to see whether it's upper right or not. So first you will have the clinician details. Below the clinician details you will have the patient details. Clinician details কি থাকবে? Name of the doctor, degree of the doctor, registration number of the doctor, at residential address as well as clinic address of the doctor, and contact number of doctor, other contact details like mail ID or something like that. এগুলো হচ্ছে ডক্টর ডিটেলস। তার মধ্যে নাম, ডিগ্রি, রেজিস্ট্রেশন নাম্বার আর কন্ট্যাক্ট নাম্বার, অ্যাড্রেস এগুলো থাকতেই হবে। নেক্সট ইউ হ্যাভ পেশেন্ট ডিটেলস। পেশেন্ট ডিটেলসে কি থাকে? পেশেন্টের নাম, জাস্ট বিলো দ্য ডক্টরস ডিটেলস ইউ হ্যাভ দ্য পেশেন্ট ডিটেলস হুইচ ইজ টু বি ফিল্ড আপ। প্রেসক্রিপশনে থাকে, দাগ দেওয়া থাকে, ওখানে ডাক্তারকে লিখতে হয় বা টাইপ করতে হয়। পেশেন্ট ডিটেলসে কি থাকে? পেশেন্টের নাম, পেশেন্টের এজ, পেশেন্টস sex, patient's height, weight, etc., and patient's address, so that you can identify the patient. So doctor's details or clinician details, patient details, and then after patient details there is a symbol that is written in every prescription, is printed, called RX, which actually means take thou. The word RX actually means the doctor is advising to the patient, take thou, take it, ঠিক আছে, RX. So these three things together, the clinician details, the patient details, and RX, these three things together constitute the superscription of the prescription. Superscription. Then you have the main body of the prescription, which is called inscription. And the inscription basically has the details of the drug that is being written. Drug. যেরকম আমি বললাম, একটা ভাইরাল ফিভারে a doctor has prescribed only paracetamol tablet when temperature rises above 100 degree Fahrenheit. এখানে what is the drug? Tablet paracetamol 650 milligram. This is the detail of the drug. Tablet paracetamol 650 milligram. ওইটাই হচ্ছে inscription. The details of the drug that is being prescribed. ড্রাগের কি কি লেখা থাকে? You have the formulation, whether it's a liquid, a solid, an injection, a syrup. So I'm saying tablet paracetamol as an example. So tablet is the formulation. So you have the formulation, then you have to write the generic name, paracetamol. Then the strength of the drug, 650 milligram or 500 milligram. So this is the inscription, the main drug details, the name of the generic name or the pharmacological name of the drug, whether it's a tablet or liquid or injection, whatever, and what is the strength. This is the inscription, the main content, in the sense, the drug that has been prescribed. And after that you go to subscription, which is direction to the pharmacist. যেরকম তোদেরকে বললাম একটা urinary tract infection হয়েছে, and the patient has been advised an antibiotic course of norfloxacin twice daily for 14 days. এখানে somewhere I will show you in the prescription a doctor has to write total 14 tablets, because for 7 days you are taking 2 tablets daily for 7 days, so you are taking total 14 tablets. To complete the course, the patient has to take 14 tablets. The patient is being advised that the patient has to take 1 tablet twice daily for 7 days. This is for the patient's advice, but how many tablets the patient will take home, that calculation is to be done by the pharmacist. So doctor will write in the prescription somewhere with a dash 14 tablets. That is the advice for the or order given to the pharmacist, that take 14 tablets and give to the patient to carry home, so that he or she can complete the course. This order or to give 14 tablets, it could have been written give 14 tablets or dispense 14 tablets. That is a better word we use, dispense. Give to the patient, dispense 14 tablets, but in general in prescription we don't write those words. Just if you write 14 tablets, it means it's the order given to the pharmacist that give 14 tablets to the patient to complete the course. This advice to the pharmacist, this part is called the subscription. These 14 tablets, I will show you the prescription, that is called the subscription. And the final advice that is in the prescription, that one tablet to be taken twice daily after meal for 7 days. This advice is for the patient to follow. That advice for the patient is called the transcription. Okay, so advice to the pharmacist is subscription, advice to the patient is transcription. And finally, at the end, in lower right end, there must be the signature. Without signature of the doctor, the prescription is invalid and incomplete. Signature must be there. Now, see, at the upper right end, here in this prescription, এক করে নাম্বারিং করেছি আমি। First, number 1, you have physician details, upper right end. I've given here my name, degree, chamber address, residence, এগুলো ফাঁকা আছে, but you have to write it. Contact number, consultation timing, and registration number. This is must. Without registration number, a doctor cannot practice. Registration number must be given. ঠিক আছে, তাহলে এইটা হচ্ছে physician details, point 1. After that, point 2 is the date. Below physician details, you have to give the date. একদম right hand এ physician details, তার নিচে date. তারপরে তাহলে right এ physician details, তার ঠিক নিচে date. তারপরে এই মাঝখানে প্রেসক্রিপশনের মোটামুটি মাঝামাঝি জায়গায় থাকবে হচ্ছে patient details. থার্ড পয়েন্ট পেশেন্ট ডিটেলস, সেখানে কি থাকবে? ফর মিস্টার অর মিসেস, যাই হোক, মিস কিছু একটা, তার নিচে এজ, সেক্স, হাইট, ওয়েট, অ্যাড্রেস, ফর এই। তো দিস ইজ দ্য পেশেন্ট ডিটেলস, থার্ড পয়েন্ট। ফোর্থ পয়েন্ট, এখানে 4 নম্বর, ফোর্থ পয়েন্ট হচ্ছে the chief complaints, the diagnosis, the relevant clinical details. These are in the fourth point. Chief complaints, diagnosis and relevant clinical details. যেরকম এটা UTI prescription কি বলেছি? Complaint of burning micturition, that is when passing the urine there is a burning sensation. Complaint of burning micturition with lower abdominal pain for 3 days. Classical presentation of a lower urinary tract infection. ঠিক আছে? So this is the chief complaint. Then the patient along with the chief complaint has also brought an investigation report, and that investigation report is written also in the prescription below chief complaint. Routine urine examination shows pus cells plenty per high power field. Urine culture shows growth of E. coli with colony count more than 10 to the power 6. So these are the details. এটা 4 নম্বর, chief complaint, diagnosis, relevant clinical details. Fifth point, এইটা RX. Fifth point, RX. আচ্ছা, ভালো কথা, ফিফথ পয়েন্টে আসার আগে ফোর্থ পয়েন্টেই চিফ কমপ্লেনের সঙ্গে ডায়াগনোসিস আছে। দেখো নিচে আমি I have given here diagnosis, urinary tract infection, diagnosis, urinary tract infection. তো এই পুরোটা হচ্ছে ফোর্থ পয়েন্ট বলছি। Then fifth point is RX. আচ্ছা, প্লিজ এখানে স্পেস হচ্ছিল না বলে, if you complete diagnosis here, RX should be here. ডায়াগনোসিস শেষ হলো, তার নিচে RX, এখানে জায়গা হচ্ছিল না বলে সাইডে লেখা হয়েছে, যাতে এক পাতায় হয়ে যায়। So RX should be here. Where you have completed the diagnosis, below that here you should write RX, and then below RX, not beside RX, below RX you start writing the prescription. ঠিক আছে? এই তো চিফ কমপ্লেন শেষ হলো, ডায়াগনোসিস শেষ হলো, ইনভেস্টিগেশন শেষ হলো, তার নিচে এখানে তুই RX লিখবি, তারপরে তুই এখানে প্রেসক্রিপশন অ্যাডভাইসটা লেখা শুরু করবি RX এর নিচে। তাহলে চিফ কমপ্লেনের নিচে RX, তার নিচে প্রেসক্রিপশন। এইবারে এই RX অবধি ফিজিশিয়ান ডিটেলস, ডেট, তোর পেশেন্ট ডিটেলস, চিফ কমপ্লেন, ডায়াগনোসিস, রেলিভেন্ট ক্লিনিক্যাল ডিটেলস অ্যান্ড RX, এই 5টা 1 + 2 + 3 + 4 + 5, এই 5টা মিলিয়ে হচ্ছে সুপারস্ক্রিপশন। তো যখন পরীক্ষার সময় you will see a prescription in the examination, you will be asked to criticize, see whether all these things are present or not, 1 to 5. if they are not present, immediately write down as a point of criticism. ঠিক আছে, এইগুলো সব আছে কিনা, যে all these points in superscription are present or not. আচ্ছা, এই হয়ে গেল 1 to 5 superscription. Now we are going into the body, that is I told you RX লিখলি তার নিচ থেকে এইখান থেকে লেখা শুরু হবে, এই লেভেল থেকে। ট্যাবলেট norfloxacin 400 মিলিগ্রাম, ট্যাবলেট norfloxacin 400 মিলিগ্রাম, this is the inscription. ঠিক আছে, আর কিচ্ছু না, এই ইনস্ক্রিপশন কিন্তু একটা, ট্যাবলেট norfloxacin 400 মিলিগ্রাম, এইটাই হচ্ছে ইনস্ক্রিপশন। এখানে অ্যারো দিয়ে পাশে বড় করে লিখেছে ট্যাবলেট norfloxacin 400 মিলিগ্রাম, দিস ইজ দ্য ইনস্ক্রিপশন। তার নিচে দেখ, ঠিক ট্যাবলেট norfloxacin 400 মিলিগ্রাম, বিলো দ্যাট আই হ্যাভ রিটেন 28 ট্যাবলেটস, 28 ট্যাবলেটস। তাহলে পেশেন্টকে অ্যাডভাইস দেওয়ার আগে আই এম গিভিং অ্যাডভাইস টু দ্য ফার্মাসিস্ট, ট্যাবলেট norfloxacin 28 tablets, this is the subscription, this is the advice to pharmacist. Dispense কথাটা, it is not written in prescription, I have given it in bracket. So first you write the inscription, tablet norfloxacin 400 milligram, just below it you write the subscription 28 tablets, which means you are telling the pharmacist give 28 tablets to the patient. And below that you now write what is the transcription or advice to the patient to follow. What have been written? 1 tablet to be taken twice daily at 12 hours gap for 14 days. So this is the final advice of transcription you have given to the patient. So superscription, inscription, subscription and transcription, you have to see all these are properly written or not. And then finally signature, lower right hand. Now very important point, this patient might be also suffering from fever because of urinary tract infection. This patient might be having an uncontrolled diabetes, for which you have to advise oral anti-diabetic drugs, otherwise the UTI will not heal. In that case this prescription will contain information regarding other drugs also. Apart from norfloxacin, you have to write tablet paracetamol 650 milligram 1 tab thrice daily for 3 days. You have to write suppose tablet glimepiride plus metformin 2 milligram plus 500 milligram 1 tablet once daily before breakfast to be continued. ঠিক আছে, তাহলে if multiple, নিচে লিখেছি দেখ, if there are multiple drugs, তার মানে কিন্তু that prescription has multiple সুপারস্ক্রিপশন একটাই থাকবে কিন্তু মাল্টিপল ইনস্ক্রিপশন, কারণ ট্যাবলেট নরফ্লক্সাসিন, ট্যাবলেট প্যারাসিটামল 650, নরফ্লক্সাসিন 400, ওইদিকে আমি বলছি গ্লিমেপিরাইড মেটফর্মিন কম্বিনেশন, এগুলো সব আলাদা আলাদা ইনস্ক্রিপশন হয়ে গেল। সো মাল্টিপল ড্রাগস মিন্স মাল্টিপল ইনস্ক্রিপশন। আবার প্রত্যেকের জন্য অ্যাডভাইস আলাদা হবে টু দ্য ফার্মাসিস্ট and advice আলাদা হবে to the patient. So there will be multiple inscription, multiple subscription and multiple transcription when there are multiple drugs. এই হচ্ছে ব্যাপার, এই হচ্ছে বেসিক স্ট্রাকচার অফ প্রেসক্রিপশন। ঠিক আছে, এইটা এবার প্রেসক্রিপশন ক্রিটিসিজমের ক্লাস আসলে তারপরে একটু এইটাই আবার রিভিশন হয়ে প্রেসক্রিপশন অডিট বলে একটা জিনিস আছে, ওইটা আমরা দেখব। ঠিক আছে, ঠিক আছে, এইটা ভুল করিস না, কারণ এটা পরীক্ষায় আসবেই। ইউ শুড বি এবল টু রাইট ডাউন। একটা কথা বলছি, প্রেসক্রিপশন ক্রিটিসিজম যখন আসবে এই স্ট্রাকচারে প্রবলেম তো বার করতে হবে। Apart from that problem in structure, there will be a pharmacological mistake, মানে এরকম দুটো ওষুধ যেগুলো একসাথে দেওয়া যায় না দিয়ে দেওয়া হবে। ঠিক আছে, যাদের মধ্যে ইন্টারাকশন হচ্ছে বা যাদের দুটো একসাথে দিলে অ্যাডভার্স এফেক্ট বেশি হবে, সেইটা তোদের ফার্মাকোলজিক্যালি আইডেন্টিফাই করতে হবে ডিউরিং এক্সামিনেশন, যে এইটা দেওয়া উচিত হয়নি একসাথে, ওইটা লিখতে হবে, ওইটা হাফ ওয়েটেজ, আর এই স্ট্রাকচারে কি কি ভুল পাচ্ছিস দ্যাট হ্যাজ হাফ ওয়েটেজ। তাহলে প্রেসক্রিপশন ক্রিটিসিজমের কোয়েশ্চেনটা ভালো মার্কস পেয়ে যাবি। ঠিক আছে।